happy to welcome to studio an incredible woman who's going to talk to us about the significance and the importance of October being Breast Cancer Awareness Month. Dr. Rebecca Lynch from Union Health. So good to see you.
Very good to meet you, too.
Thank you for being here. Listen, we are having these important conversations this month. I feel like we should have them all year long, but this is Breast Cancer Awareness Month. And so when we first talk about what it is that you do in your role as a general surgeon when it comes to breast health.
Absolutely. So I think that breast health and breast cancer awareness is extremely important. What's critical is that knowing that when your breast cancer is diagnosed very early, this is very treatable. And then someone like me as a surgeon, we can remove the cancer and start that treatment plan for you so that you can essentially become cancer-free. And that is really the goal, is to treat breast cancer. And so my role in that is to remove the cancer and help with any other treatments specifically to identify are there lymph nodes involved, the rest of the workup, and then making sure that we have oncology, radiation oncology, and our other specialists involved in the care as well.
I always think to myself, it's that fear of hearing it when someone tells you you have breast cancer. And so someone like you is that comforting step in the next part of the process, because removing it and finding it early, like you said, can be life-saving, right?
Absolutely.
And mammograms are the key part to make sure we're finding it early. And this month, I know at Union Health, you are really saying get those mammograms scheduled, right?
Yes, absolutely.
How important are they?
Mammograms are critical. The mammogram is one of the best modalities to be able to find breast cancer or high-risk lesions that could become breast cancer very early when they're treatable. And when you look at guidelines, guidelines have changed a lot in the past even 10 years, but you look at them through history, we really have a lot of better resources to diagnose breast cancer early. For the guidelines specifically, when you look at all of the different guidelines from each of the medical associations, I would say my recommendation is really to start getting your mammograms at age 40.
Okay.
We are seeing younger and younger breast cancer, and that is why the guidelines have changed over time and become younger and younger ages than what you previously may have heard.
And you know, when you talk about those guidelines, I feel like there's even been changes in my lifetime. I'm now in my mid-50s, and I have very dense breast tissue. So what started as just a mammogram for me over time has now come to the point where I'm being scheduled for an MRI.
Absolutely. And I think this really goes to show that it's very important that each patient really meet with their physician at a minimum once a year, or your advanced practice provider who provides your primary care. And you really need to talk about your breast health, your family history, your specific risk factors. And then when you get that annual mammogram starting at the age of 40 for an average risk individual, you need to go through that mammogram. If you do have dense breasts, they may recommend MRI or ultrasound as additional testing to help ensure that you're picking up everything that you need to early on when it's treatable.
And what's nice is at Union Health and with the Clara Fairbanks Center, what an incredible facility you have.
Thank you.
It makes it so great for women because we come into a space where I almost feel like they comfort me when I come there. You know what I mean?
Absolutely. I love the team at Clara Fairbanks. We are so lucky to have them. Great people, and I myself am a patient of Clara Fairbanks too, and it's just a wonderful, wonderful team.
To the person watching right now who sees this, to the woman who maybe has been nervous or scared or afraid to get a mammogram, what would you say to them, especially now this Breast Health Month, to make sure they're doing what's right?
Absolutely. So I would say that I understand being scared to come for any medical procedure, even to come visit your physician or your advanced practice provider. That can be just scary in itself, but we're here to help you. The Clara Fairbanks team is very welcoming. We are going to make it as private, as comfortable, as personal as we can, and that's really important. Same thing with all of the rest of the team. Should you be diagnosed with breast cancer, our goal is to diagnose it early so that we have more resources to treat you, and so the chance of completely curing your breast cancer is extremely high. And we have a very welcoming team with a lot of support staff that will help you feel the most comfortable possible.
We're so lucky to have doctors like you.
Thank you.
You know, and I thank you so much because truly it is an important month, and that's why you need to scan the QR code right there on the screen. It will take you to union.health. There you'll find a resource of information about screening your mammograms. You'll find out about physicians and all the things that you need to know. Union.health for more information. Scan the QR code on the screen for details about this important month to schedule that mammogram soon, right? Sooner than later. Dr. Lynch, thank you so much. Great to meet you once again. Union.health for more information, and stay with us. We've got more to come on Good Day Live.